If your doctor recently told you that your blood pressure is right where it should be, and you walked out of the clinic feeling confident everything was under control, I want you to stay with me for the next few minutes before taking your next blood pressure pill tonight. Because what you're about to hear may challenge something millions of people have been told for years. By the end of this video, you'll understand your blood pressure in a way that most routine doctor's appointments simply don't have enough time to explain. I'm Dr. William, a board-certified cardiologist with more than 32 years of experience treating over 40,000 patients. During those decades, I've learned one important lesson: for adults over the age of 65, one of the most dangerous words in blood pressure care is perfect. That may sound surprising, but for many older adults, a blood pressure reading considered ideal can sometimes create problems that go unnoticed until a frightening moment, like getting out of bed in the middle of the night, standing up, and suddenly feeling the room spin around you. Before we continue, I'd like you to leave a comment with just your age. That's all. The information I'm about to share applies differently to someone who's 65, 75, or 85 years old. And if you've ever experienced dizziness or lightheadedness after standing up from a chair or getting out of bed, type the word dizzy in the comments as well. In just a few minutes, you'll understand why that symptom deserves much more attention than many people realize. Let me tell you about one of my patients. Her name was Dorothy. Dorothy was 79 years old when her daughter first brought her to see me. She was independent, quick-witted, and still drove herself to church every Sunday. She had been living with high blood pressure since she was 68. Like many patients, her treatment began with one medication. Later, another was added. Eventually, she was taking 3 different blood pressure medicines. The goal remained the same every step of the way: get her blood pressure as close as possible to 120/80. Every time her numbers improved, her medical record received the same reassuring note: blood pressure well controlled. Dorothy believed she was doing everything right. She trusted her doctors. She trusted her medications. Most of all, she trusted the number on the blood pressure monitor. Then, one ordinary morning, about 4 months after her readings had finally settled around 122/76, she stood up from the breakfast table to grab her coffee. Within seconds, she became dizzy. Before she had time to react, she fell. As she tried to catch herself, she fractured her left wrist. When emergency medical personnel arrived, they measured her blood pressure while she was lying on the kitchen floor. It read 118/74. Then they helped her stand. Almost immediately, her blood pressure dropped to 86/58, a dramatic 32-point fall in her systolic pressure. That meant her brain wasn't getting enough blood every time she stood up. The frightening part? This had likely been happening for months. Dorothy had already mentioned feeling dizzy during 2 previous doctor's visits. But her symptoms were written off as normal age-related changes. The recommendation was simple: stand up more slowly. No medication review. No additional testing. No changes to her treatment plan. Just a suggestion to be more careful. Although Dorothy's wrist eventually healed, her confidence never fully returned. She became afraid of falling again. She stopped driving herself to church. She spent less time outside her home. Slowly, her world became smaller. About 11 months later, because she was moving around much less, she developed pneumonia and spent more than a week in the hospital. She recovered, but she never returned to the independent lifestyle she once enjoyed. Afterward, Dorothy's daughter asked me a question I've never forgotten. How could a blood pressure that's considered perfect lead to something like this? That single question is exactly why I'm making this video. If you've ever felt dizzy when standing up, leave the word dizzy in the comments right now. Because Dorothy's experience may sound familiar, and it could be happening to more people than anyone realizes. For decades, we've all heard the same advice: the lower your blood pressure, the better. A reading of 120/80 has long been promoted as the ideal goal, and for many adults in their 40s and 50s, that recommendation has strong scientific support. I've followed those guidelines throughout much of my career. But as people grow older, something important begins to change. After the age of 70, the cardiovascular system no longer functions the way it did at 50. Yet many treatment plans still rely on research that wasn't designed to answer one crucial question. What blood pressure target is actually safest for older adults with age-related changes and multiple health conditions? I'm not going to reveal the numbers I recommend just yet. If I gave you those targets now, some people would simply write them down and stop watching. Without understanding the science behind them, those numbers could easily be misunderstood or even applied in the wrong situation. Before discussing blood pressure goals, you first need to understand why your body at 75 is fundamentally different from your body at 55. Let's begin with the research. Back in 2015, researchers published one of the most influential blood pressure studies ever conducted. It became known as the SPRINT trial. The study followed more than 9,300 adults over the age of 50, with an average participant age of about 68. Researchers divided volunteers into two groups. One group aimed for a systolic blood pressure below 120. The other group targeted below 140. When the results were published, they made headlines around the world. The intensive treatment group experienced fewer heart attacks, fewer strokes, and fewer cardiovascular deaths. Almost overnight, the message became simple. Lower is better. Doctors adjusted medications. Blood pressure targets became more aggressive. Patients celebrated reaching numbers below 120. But there was a critical detail hidden beneath those headlines. And it's something many patients never hear during a routine office visit. The SPRINT trial did not include many of the older adults doctors see every day. People with diabetes were excluded. Individuals who had previously suffered a stroke were excluded. Patients with dementia were excluded. Those with advanced kidney disease weren't part of the study. Neither were many frail older adults with multiple chronic illnesses. In other words, the people used to establish these blood pressure targets were generally healthier and less medically complicated than the average 75 or 80-year-old sitting in a clinic today. They weren't patients like Dorothy. And they may not be patients like you. There's another important point that often receives much less attention. The aggressively treated group also experienced higher rates of dizziness, fainting episodes, kidney-related complications, and falls that required hospitalization. The cardiovascular benefits were genuine. But so were the risks. Then, several years later, another major study reached similar conclusions. The STEP trial, published in China in 2021, followed more than 8,500 adults between the ages of 60 and 80. Once again, researchers found that lower blood pressure targets reduced cardiovascular events. But they also observed an increase in dizziness, falls, and stress on kidney function. After more than 3 decades of caring for older adults, these findings reinforced something I'd already been seeing in everyday practice. Clinical trials answer valuable questions. But they don't always reflect the reality of the patients sitting across from us in examination rooms. Many treatment guidelines are built using carefully selected study participants. Real patients, however, often have multiple medical conditions, take several medications, and experience age-related changes that research trials may not fully represent. That difference matters. Because when research findings are applied too broadly without considering the individual, problems can occur. Sometimes those problems appear as dizziness. Sometimes they appear as repeated falls. And sometimes they change a person's independence forever. Dorothy didn't fall because anyone ignored the science. She fell because the science that guided her treatment didn't fully match the person she had become. That's why understanding your own body, not just your blood pressure reading, is one of the most important conversations you can have with your healthcare provider. Now let's talk about why your body changes after the age of 70. Because this is the key to understanding why a single blood pressure target doesn't work for everyone. There are 3 major age-related changes that affect how your cardiovascular system responds to blood pressure. The first is stiffening of the arteries. Think of a brand new garden hose. It's soft, flexible, and easily expands as water flows through it. Now compare that to an old hose that's been sitting outside for decades. It's rigid, less flexible, and doesn't absorb pressure the same way. Your arteries go through a similar transformation as you age. Over time, the artery walls naturally become stiffer. As a result, when your heart pumps blood, those vessels can't cushion the pressure wave as effectively as they once did. That means your body often needs a slightly higher resting blood pressure to deliver enough blood to vital organs, especially your brain when you're standing upright. The second change involves tiny sensors inside your blood vessels known as baroreceptors. These sensors constantly monitor blood pressure and help your body react whenever it changes. When a healthy 30-year-old stands up, gravity immediately pulls blood toward the legs. Within fractions of a second, the baroreceptors detect the drop in pressure and send signals that increase heart rate and tighten blood vessels. The result is simple. You stay conscious without even noticing the adjustment. As we grow older, however, these sensors don't respond as quickly. Their reactions become slower and less efficient. If your blood pressure is already being pushed very low with medication, standing up can temporarily reduce blood flow to the brain before your body has enough time to compensate. That's when people experience dizziness. That's when vision may briefly darken. And in some cases, that's when a dangerous fall occurs. The third change involves how your body processes medication. As we age, the kidneys and liver gradually become less efficient at clearing many medications from the bloodstream. A dose that worked perfectly 5 or 10 years ago may remain in your body longer today. That means the same prescription can have a stronger effect than it once did even if nothing about the dose has changed. This is one reason routine medication reviews become increasingly important with age. A blood pressure reading taken while you're comfortably seated in a doctor's office only tells part of the story. It doesn't reveal what happens when you stand up, walk across the room, climb a flight of stairs, or wake up during the night. That's why I recommend a simple test you can perform safely at home. All you need is a reliable home blood pressure monitor. First, lie down and relax for 5 full minutes. Take your blood pressure while you're still lying flat and write down both numbers. Next, stand up carefully. Without waiting several minutes, check your blood pressure again as soon as you're standing. Compare the two readings. If your top number, the systolic pressure, drops by more than 20 points, or your bottom number falls by more than 10 points, it may indicate a condition called orthostatic hypotension. This simply means your blood pressure falls significantly when you stand. It's more common in older adults than many people realize and is often linked to medications, dehydration, or age-related changes in the cardiovascular system. Most importantly, it's something your healthcare provider can evaluate and often improve once it's identified. That's why these home readings can be so valuable. Instead of relying on a single office measurement, they provide a clearer picture of how your body responds during everyday life. If you decide to perform this test, write down every reading. Bring those results to your next medical appointment. They can help your doctor determine whether your current treatment is working well or whether adjustments should be considered. Never stop or change your medications on your own. But don't ignore symptoms like dizziness, weakness, blurred vision, or feeling unsteady simply because someone tells you they're just part of getting older. Sometimes those symptoms are your body's way of saying it needs a different approach. The goal isn't simply achieving a certain number on a blood pressure monitor. The real goal is protecting your heart, preserving your brain, and helping you stay active, independent, and safe. Before I explain the blood pressure ranges I commonly discuss with my patients, I want to ask you something. The purpose of this channel is simple. I believe older adults deserve clear, evidence-based medical information presented in everyday language, not oversimplified headlines or rushed explanations squeezed into a short office visit. My goal is to share the same practical framework I use during conversations with patients, so you can better understand your health and have more informed discussions with your own physician. If you found this video helpful so far, consider subscribing and giving it a like. Every subscription helps this information reach more people who may never have heard that blood pressure treatment should be personalized rather than one size fits all. You never know whose life could be changed simply because they saw this message at the right time. Now let's talk about what I call knowing your real number. Your ideal blood pressure isn't determined by a single guideline. It should take into account your age, your overall health, the medications you take, your risk of falling, and how you actually feel from day to day. For adults between 60 and 74 who remain active, independent, and have few medical problems, a systolic blood pressure between 125 and 135 is often considered a reasonable goal based on current evidence. But that picture changes if you're in the same age group and also have conditions such as diabetes, a previous stroke, several chronic illnesses, or you're taking multiple medications, especially if you notice dizziness when standing. In those situations, trying to force your blood pressure down to 120 may not provide the safest balance between benefits and risks. For many people in this category, a systolic pressure around 135 to 145 may still offer meaningful cardiovascular protection while reducing the likelihood of dizziness and falls. Remember, adding more medication doesn't automatically mean better protection. Sometimes it simply increases the chance of unwanted side effects. Now let's look at adults between 75 and 84 years old. If you're generally healthy and living independently, many experts now recognize that maintaining a systolic pressure in the 135 to 145 range may be more appropriate than aggressively pursuing 120. Research continues to suggest that extremely low blood pressure isn't always associated with the best overall outcomes in older adults. The healthiest target often depends on the individual sitting in front of the doctor, not just the number printed in a guideline. For adults 85 years and older, or anyone who is medically frail regardless of age, preventing falls and maintaining independence frequently become higher priorities than achieving an aggressively low blood pressure reading. For these individuals, a systolic pressure around 140 to 150 may represent a safer and more practical range, depending on their overall health and the recommendations of their healthcare provider. I know those numbers may seem higher than what many people have heard for years. But medicine isn't about treating a chart. It's about treating the person. There's another number that deserves far more attention than it usually receives, the diastolic pressure, or the bottom number. In many older adults, if the diastolic pressure regularly falls below 60, blood flow to the heart muscle during its resting phase may become less efficient. Ideally, many older adults benefit from keeping that lower number somewhere between 70 and 85, although the right target depends on individual circumstances. If your diastolic pressure consistently stays below 60, it's worth discussing with your doctor, even if your systolic pressure appears to be well controlled. Let's look at two examples. Bernard is 72 years old. He plays golf twice a week, has good kidney function, no diabetes, and no history of heart disease. His blood pressure averages around 142/84, and he feels perfectly well. Should another medication automatically be added just to reach 120? Not necessarily. For someone like Bernard, lowering his pressure too aggressively could increase his chances of dizziness or falls while providing only a small additional cardiovascular benefit. Now consider Gloria. She's also 72 and has a blood pressure of 142/84. But unlike Bernard, she has type 2 diabetes, reduced kidney function, and has previously experienced a cardiovascular event. Although their blood pressure readings look identical, their treatment plans shouldn't be. Gloria may benefit from gradually lowering her blood pressure toward the 130 to 135 range while being monitored carefully for symptoms and checking for blood pressure drops when she stands. The numbers are the same. The people are different. And that's exactly why individualized treatment matters. Medicine works best when it treats the patient, not just the reading on the monitor.